Hope for Tomorrow is sponsored by Stonegate Center, providing effective Christian drug and alcohol addiction treatment for men.
Welcome to Hope for Tomorrow. I'm Dr. Nina Rios-Doria.
And I'm Todd Baker. You know, today's show is about addiction, how it happens, and what we can do about it.
We need it, especially now that the holiday season is kicked off. Well, with Black Friday today, that causes not only stress, but it can lead a lot of people to making some really poor choices because of the overwhelming feelings that a lot of times the holiday season brings.
I agree.
Yeah.
And we're going to spend most of the segment really talking about alcohol addiction and drug addiction.
Yeah.
But there's another kind of addiction that I wanted to really address because I think it's really prevalent in our society and we don't really talk about it much.
Yeah.
And it's a pretty serious addiction.
Right.
Is that a pornography or a sex addiction or sexual addiction? So I just want to hit on just a couple of statistics to give you an idea of really how prevalent it is in our society and how much it affects not just us, but also our kids as well. Right now, at any given second, they estimate about 30,000 people are watching pornography right now, again, at any given second.
Yeah, it's a lot.
Some of the stats show that more than 50% of boys and more than a third of girls see their first pornography image before the age of 13, and some other places even said before the age of 11.
Yeah, and there's a story along with that you just mentioned. I remember going to a seminar about pornography and how sometimes kids are exposed to it unexpectedly because they have siblings or older siblings and they walked in at the wrong time and they viewed some very graphic porn, and it affected them like if they were sexually abused, that response. So it's scary today, especially with the access of the internet. And it's just something we need to talk about because so many people are struggling. And when we, like you mentioned, we're going to talk about drug and alcohol. It's another way people cope. This is a coping mechanism. Pornography, turning to that is a way to cope. And it's recognizing that. Because the people that get caught in it, when you see your spouse or significant other that are addicted to porn, their feelings of emotion is just overwhelming, and they're thinking a lot differently than what the truth is about it.
I agree. And I'd like to just kind of hit on some of the stages that people go through.
Yeah.
Because, again, it's just like any other addiction. You just don't immediately wake up and become addicted.
No, you don't.
There are certain stages to it, and pornography addiction or sexual addiction is a little bit different. Very first thing is early exposure. And that's what we just talked about.
Yeah.
Is, you know, seeing kids that are seeing pornography for the first time or at least lewd images, less than 11 years old, 9, 10 sometimes.
Yes, and sometimes it starts off really innocent, and then it's something they get pulled into more and more, and they're not even recognizing it, and it just becomes, it goes to another level at times. And then, so you're talking about the second stage is?
The second stage is addiction, is actually craving going back and looking at it more often, which kind of leads us into the third stage, which is what they call escalation.
Yeah.
That's moving from some of these lewd images that you see into actual, what you'd call hard pornography, something that's much more graphic, and you know, needing that. Which again leads us then to a desensitization process.
And I want to say on that stage right there, because at that point, when they're at that stage right there, their view of women, or if we're talking about from a men's perspective, is skewed on how they see women. If they're in a relationship, that relationship now has changed. There's something different about that relationship. And so if I'm talking from that perspective, women are feeling very overwhelmed when they find this out. And it's just recognizing, like you said, there's different stages, and being aware this is so not about them, though it feels like it. It's a way that they're trying to cope right now. It's a lack of, they're trying to, a lot of times this is about not sharing and being personal, and they're craving that intimacy, and they don't know how to talk about stuff. And that gets them to the different stages. And stage 4 would be what?
Yeah, stage 4 is desensitization, and then stage 5 is acting out. All that means, you can kind of wrap that in together. It's that ramping up process. It's seeking the next level. And we're going to talk about that a lot with all addiction. It's always going to the next level. Some people call drugs gateway drugs. Soft porn, kind of gateway pornography. Moving into harder things, and then eventually to acting out on it, seeking that outside influence. And that's really a dangerous place to be.
It's scary, and again, this is a lot to do with the brain and how the brain becomes addictive. And I know Will Stoy from Stonegate Center is going to talk a lot about that.
That's right.
And how relevant that is to pornography as well.
I agree.
So some of the things that, in regards to pornography, how if someone this is like resonating with them, what they can do and get help is, first of all, just the awareness. someone that is dealing with this is owning, I'm struggling with this and I need some help.
It can be a private addiction, but it affects us in a public way. And so again, if we encourage, if someone is dealing with this, seek help. Don't try to deal with this on your own, because it's a powerful, powerful addiction.
We'll be right back to share more about addiction. Plus, we're going to have an expert in the field joining us from Stonegate Center. Is there a cure? We'll find out next with Will Stoy.
Hope for Tomorrow is sponsored by Stonegate Center, providing effective Christian drug and alcohol addiction treatment for men. Hope for Tomorrow is sponsored by Stonegate Center, providing effective Christian drug and alcohol addiction treatment for men.
Welcome back to the show. Joining us now is Will Stoy. He's the executive director from Stonegate Center to talk more about addiction and how popular it is right now, especially during the holidays. And right before we went to break, we talked about, is there a cure to this? And what is your response to that?
Unfortunately, there's not a cure. It's a very treatable disease, but there's just no cure for it.
It's interesting you mentioned treatability, and we're going to talk about that. But before we move into that realm, I know that y'all deal with alcoholism a lot. I assume you also work with drug abuse. So what would you say is kind of the difference between the two?
I would say there's not much difference between the two, between alcohol and drug abuse. They kind of go hand in hand. You see very little difference, really.
Okay. All right.
One of the things that, again, during the holidays or just any time, I'm thinking of a client right now where she was wondering, does my husband have an alcohol problem? You know, what are some signs that your spouse or a friend or maybe yourself that you might have a drug addiction or an alcohol problem? When do you know that?
I would look at a person's inability to control their drinking. So if they say, I look for a firm resolve. Is there a time in your life when you said, I'm through drinking, I will not drink, I will not use anymore? And if you make that resolve and then you find yourself drinking or using again, there's a good chance that you're suffering from addiction. Secondly, I would look for whether or not they are able to say, I'm going to have 2 beers, I'm going to have a glass of wine. And if they say that and are not able to stick to what they say they're going to drink, then that's another good indicator of there may be some addiction going on here. And then, just a kind of a caveat to that, sometimes you will see somebody who is suffering from addiction be able to stick to that number. It's hard, but they're able to stick to it. But then you start looking, is there irritability, anger, stuff like that going on that kind of indicates like you stuck to it, but you're miserable.
Yeah.
Well, it's important to note, though, that there are physical addictions and also emotional addictions, and they often go hand in hand. It's all about that feel-good moment, I guess you might say.
Exactly.
So what can you tell us a little bit more about physical versus the emotional side of addiction?
Yeah, and I think that's where we get into some brain chemistry. We start looking at, heroin, marijuana, their chemical makeup really mimics, some natural neurotransmitters very well. So what you start seeing is the brain starts getting confused. The brain doesn't produce some of the natural chemicals that it normally would. You see that dopamine, whereas when you start using, you're flooding it, so you have that euphoric effect. Well, your body wants that euphoric effect. Right. Dopamine was created, to tell us like, man, this is good, keep it up. And all of a sudden, when you're artificially producing that, your body says, well, I don't need to do this anymore. So what we see is there's decreased dopamine, there's decreased receptors. So then all of a sudden you start seeing depression, anxiety, and other things start to come up,
Because they're not feeding that addiction.
Exactly.
And that goes for the pornography, as we were talking about earlier. The same kind of cycle happens, right?
Yeah. There's something called activator protein 1. And what that is that follows the dopamine, that follows the neurotransmitter, and it goes with it, and it starts creating a path. And as I told you guys earlier, I'm outdoors. So when I'm thinking about an animal trail, like that is an animal trail that's used, regularly, and all of a sudden the healthy connections that we had, no longer, that's not our default anymore, Brushing your teeth. If you're right-handed, try brushing your teeth with your left hand. It's horrible. You can't do it, and it takes a while. If you do it over time, then all of a sudden you become fluent. And it's the same thing with porn or drugs. Your body becomes dependent because of those pathways that you're starting to create.
And they really can't stop it without the kind of intervention. The intervention that Stonegate Center provides and other centers. But what do you think the first step for someone to start recognizing that they might need some help?
I think just admitting that they have a problem, just admitting that, that I'm, step one of Alcoholics Anonymous, I'm powerless. They don't have the power to not drink or not use.
Yeah. I think, that's so true with anything we're talking about when it comes to just when you're doing something that's not okay, is acknowledging it, accepting it, and saying, you know what, I do have a problem and I need to get help. And that's what we're going to talk about next, is what, people can do to get the help and treatment they need. So, next up, we're going to continue discussing all the steps and that we can take to get help, but also tools specifically you can use to help you with someone with addiction. Next.
Hope for Tomorrow is sponsored by Stonegate Center, providing effective Christian drug and alcohol addiction treatment for men.
Welcome back. We're back here again with Will Stoy, the Executive Director of Stonegate Center. We've talked a lot about, what drug and alcohol addiction is and everything, but now let's talk about how families can help a family member or themselves with this. What are some things they can start doing to get the help they need?
I think really reaching out, I think that's the thing. A lot of times, you have that shame component and that fear component of addiction, and I've got a family member struggling, I'm struggling. So we don't want to say anything. We're just really quiet and, and keep it a secret. So I think the first thing is to realize you're not alone, and to reach out to your church, to somebody who's possibly struggled, and just, admit this is what's going on.
That's a big thing, because I think that most people caught in addiction really do feel like this is my addiction. And they don't really connect and see how it affects so many other people around them. And then also learning how to include those people in the treatment process is a big thing, because you mentioned that shame factor and things like that.
Exactly. And just like with porn, I mean, those aren't things, porn addiction, being drunk all the time, being high all the time, that's not something that that you really want to just show everybody and let everybody see. So yeah, it's really important just to go ahead and really, take that step and admit this is what's going on.
And then once you do, and let's say they're at Stonegate Center and they're getting treatment, what have you found there that's really helpful for the men that you treat, that really you see a great recovery for them?
I tell you, the thing that I see that makes the biggest difference in a man's recovery is his family working on their issues too. We talk about addiction as a family disease. It affects everyone, just like you said. It's selfish to think it's a selfish disease, but it's even more selfish to think that you're the only person that it affects. It's affecting everyone around you.
Right.
And the family has adapted, and they've taken on, maladaptive patterns of behavior in order to cope. It's kind of, they have to survive too. So I think families really reaching out to programs like Al-Anon, the local church, people like that, us, depend on us for help. We have a solid family program. So I think that's very helpful for guys in recovery.
So what other treatment options are there available out there?
For the families? I would say Al-Anon is big, that's alcoholics go to Alcoholics Anonymous, the family members go to Al-Anon. I think that's huge, because they're in there with people who are going through the same thing they're going through. You think that, man, I'm so embarrassed, nobody's going to understand, and you go into that room and you have, 5 people walk up and you share your experience, and they said the same thing happened to me. This is how I got through it. That's helpful, and I think, when you're looking at a treatment center, see how they view families. Is this going to be something to where you go for, 30, 60, 90 days, and the person in treatment's getting all the help, but families are receiving nothing? Look for somewhere that the family's getting some help. And I always encourage families to seek out their own counselor too.
Yeah.
There's a lot of different ways of doing therapy and treatment. But you mentioned one at break that I think is really key. And it's not really a type of treatment, but you mentioned letting it go for the family. What do you mean by that?
Letting it go. I mean, the family has to come to a point to where they realize, like, while they think they have their addict, they really don't have them. They have them on the addict's terms. And that's really no way. You see the family's so distorted at that point. So you really have to get to a point, and where I've seen families successful in this is really when they're able to, you hear people say, give it to God all the time.
Yeah.
And what does that look like? That looks like, well, maybe this Christmas, if they don't choose to go to treatment, they're going to be homeless, and being okay with that. Now that yes, it hurts. I'm not saying that you're not going to have normal emotions and everything that goes along with that, but just really being able to separate from that, detach with love, and let them experience what it might take in order for them to say, you know what, I don't want to be homeless next Christmas.
You know what, I think that's the most difficult part with people listening, to take that step, to say, I'm not going to support this anymore, and what that consequence is for that other person. It is hard, and I think that's why there's so much enabling going on.
Exactly.
Right?
Yeah, and I like to say disabling when I talk about, so when I think about being enabled, I think about people giving me tools to really make it. But what families are really doing when they're taking them in off of the cold streets, when they're, paying, the umpteenth bill for a lawyer to get them out of these consequences that they should probably be facing, I call that disabling, because you're really setting them up for a hard fall.
And that's where they're going to learn, and that's where they're going to get help. One of the things I know that you talk about in Stonegate is accountability, what you practice. Can you talk more about accountability?
Yeah, I think we really focus on community and that accountability aspect of community. Having somebody that's going to care more about me as a person than the friendship. They're willing to risk the friendship for the friend and really say, hey, that path you're going down is really going to lead to destruction. What you see as a little white lie, that can't exist in your life anymore if you're going to have sobriety. So I think an accountability for Al-Anon, for the families, I think that's huge too, because it's so easy, just like it is easy for a person struggling with addiction to go back to the drug. It's so easy for the family member to go back to the person addicted and to get back into that pattern really quickly.
So where does someone go if they are, maybe our viewers are not around any kind of a treatment facility, or they can't afford it or whatever? Where does someone go to find help?
I would say go to churches are great resources because they can usually connect you with a counselor. I would say that would be my first choice. Reach out there, but call treatment centers. That's one thing I can say about this industry is we're really good about finding people a place to go. Yeah, you may not be able to afford a certain center, but there's plenty of other places out there. And everybody that I talk to, and I know Stonegate as well, we work with people because we understand, there's a high cost, but there's also a high reward. And we really have a great referral network and stuff like that. So we're able to, get people plugged in. But Alcoholics Anonymous, for somebody who has absolutely no money and no time, Alcoholics Anonymous is great.
Yeah. Well, AA, that's just one that it's out there. It does help. There is, but if they want more of a treatment center like yours, then that's another place that they can consider as well.
Yeah, for sure.
Yeah. So anything else you can think of that people would be helpful information for them to know about?
Yeah, I think when you make the decision to go into treatment, usually it takes the guys a little bit of time to surrender and to really listen. But I would really encourage the families, understand you're going to be stretched too. We're not going to, if we're keeping you in your comfort zone, we're not doing our job. So I would say, pick a place to go to treatment that you're going to trust, because you're going to be stretched and you're going to be asked to do things that are completely uncomfortable. But if you don't trust the people who you've chosen to help, success is going to be, very minimal.
That's a key thing to remember, is that it takes commitment more than anything.
Exactly.
And there are times whenever we have to admit that some people are not ready to make that real commitment to make a change.
So.
That's huge.
And they have to be ready, and they have to trust it, because, like you said, it's going to be uncomfortable for them too. So it's a family support to get through this.
Exactly.
So, well, thank you, Will. This is great information, and we appreciate you being here.
Yeah.
All right, our final thoughts are coming up next, reminding all of us today that there is hope for tomorrow, especially with addiction.
Hope for Tomorrow is sponsored by Stonegate Center, providing effective Christian drug and alcohol addiction treatment for men.
Welcome back to Hope for Tomorrow. And, after meeting with Will and talking about all that stuff, it's a lot for people to process. So
it's a heavy topic.
It's heavy. And so I know that we had some inspirational things, and you had something to say that you wanted to share with everybody to give them hope.
Yeah, definitely. Yeah. I just wanted to end with this. It's just a quote. It says, "Finally, brothers, whatever is true, whatever is honorable, whatever is just, whatever is pure, whatever is lovely, whatever is commendable, if there is any excellence, if there's anything worthy of praise, think about those things.
Yeah, I love that. It kind of brings everything together, just to stay hopeful, positive, and all those good things we need to stay during the holidays and when we're dealing with our family members that are dealing with all these things. It's just good to remember there's hope and there's some positive things we can think about.
That's right.
So, with that being said, that's it. So thank you so much for joining us. And if you have a question or a comment about addiction, go to texas47.com and click on our Facebook page, or they can send us a comment. We want to hear your thoughts about today's topic.
And next week, we'll talk about how to have balance in your life during this busy holiday season, so you won't want to miss it.
Yeah, it's great tips to come right here on Hope for Tomorrow.
Hope for Tomorrow is sponsored by Stonegate Center, providing effective Christian drug and alcohol addiction treatment for men.